morning, good afternoon, and good evening. Welcome to the 424th session of Ifph. Before we proceed, let us have a silent prayer for 1 minute. Thank you. As I already mentioned, this is the 424th day of continuous Zoom session of Ifph. Today, our chief guest is Dr.Unni Veliath, member at Faculty Cell of IHK. More than 30 years experience in clinical practice. The relevance of miasm in fever prescription. We all know that the importance of miasm is just like a string which connects almost all the phenomena or events that happening in the body. So one must be very cautious or bothered about this string that connects all these symptoms to become a disease. So we'll on behalf of IFPH, I am once again welcoming Dr. Unni Veliath. You can have the session for the next 48 minutes. Over to you, doctor.
Good evening. Okay, this subject shall be a different subject because in most of the time, ailments from and the change in dispositions are considered for prescribing fever and other acute disease management. In miasmatic aspect, acute diseases are purely psoric and commonly need antipsoric medicines. Sometimes in chronic diseases, we consider the other miasm out of psora in prior importance. But the lesson we studied from COVID-19 like illnesses were different. It directs us to think in a miasmatic point of view in prescribing such conditions. Lesson learned from a failure. It was my second COVID case I treated. It's middle of the year 2020. The patient was an Ayurveda doctor, aged 68 years, have asthma and diabetes mellitus controlled on diet. His wife, being a homeopath, communicate over phone and prescribed medicines according to the usual criteria followed in acute disease management. Showed improvement in the first days. Then the case moves to respiratory distress and undergo ventilator. Later on, he returned back from that danger situation with moderately severe post-COVID sufferings. Once again, he approached me for the post-COVID management. Now I took the case in details. The remedy comes as constitution was ignatia. He is very anxious and hysteric nature during any crisis. On administering ignatia, he shows satisfactory improvement. From this experience, I tried to identify a back-end miasmatic remedy for further COVID prescription for in a curiosity. We have seen a variety of onset, progression, and prognosis in COVID-19 patients. Many of that could be mild or moderate. That is, starts with the psora and ends in psora. Many could be seen moving to unexpected level and causing accidents to death. By this, when we think about why it happens, we can understand that some cases starts with the psora, then it progresses rapidly to syphilis. It shows that miasm may be the triggering factor in the progress of the disease in the homeopathic point of view. The basic, the fundamental miasm of that person may be zorosyphilitic or syphilosoric. When we categorizing those affected by COVID-19 in the above perspective, mortality may have happened in syphilosoric patients. Those who finally to ventilator in a great complexity and later recovered are zorosyphilitic persons. People with relatively severe symptoms and long-lasting post-COVID suffering who are slowly progress to complication and death are psychosyphilitic persons. People with relatively severe symptoms and long-lasting post-COVID conditions who are slowly returned to normal health are sauropsychotic persons. In purely psoric people who show only very simple symptoms and recover without even using medicines. The early anti-miasmatic prescription is a must in the above two category patients to avoid unexpected complications in syphilitic and syphilosoric and the sorosyphilitic cases. In both cases, the speed of progress will be very fast. The cytokine storm occurs in such people. In sorosyphilitic or syphilosoric miasmatic group of people. In soric and psychosyphilitic or syphilitic cases, we need to look for syphilitic symptoms in the mind and generals and also in the particulars. Why? When body reflects soric or psychotic symptoms, we search for the syphilis in every case, as syphilis is the most and worst and most destructive miasm. We try to identify the syphilitic symptoms from that case, but it was very less. It will be very less because the case, in acute condition, majority of the symptoms will be soric. But we try to find out the syphilitic symptoms. Though the disease symptoms are in lower miasmatic manifestation, mind has already shifted the gear to syphilis, manifesting itself in general in minute peculiar particulars. When we treating in psychotic or the acute condition in soric cases, the majority of the physical or the general symptoms or in the particular level, the majority of the symptoms present will be in the status miasmatic level, that is either soric or psychotic. But in mind and generals and in peculiar particulars, there will be a shifting to syphilis also. There will be a shifting to syphilis also, and in the minute particular symptoms, that is PQRS symptoms. We try to find out that symptoms. It will give to trigger, give to control the trigger from that the psoras to the syphilis or the to the complication. Psychosis being the most deceiving miasm occurs up the syphilis. So when we miss to find the syphilis, we tend to suppress or even miss the case itself. That was happened in the my COVID case. I treated in usual criteria, but I have failed to find out the syphilitic or the danger miasm in that patient. But that was that was hidden in that condition. So the usual prescription will not cover the syphilitic or the danger condition. The patient shifts to the danger level or the in a complicated level, the case is complicated to further the palliative treatment. In acute disease, we may have a prescription for the front end and a back end in the miasmatic perspective. Front end remedy shall be selected by considering the peculiar from the particular, that is PQRS symptoms. The front end remedy peculiar from the particular, that is PQRS symptoms. That is the front end symptoms that we have to observe. The back end remedy shall be selected by considering the sorosyphilitic or the psychosyphilitic, that is out of control or fast progressing symptoms from the mind. The back end remedy we can select it from the mind, the sorosyphilitic or the syphilosoric, sorosyphilitic or syphilosoric quality of the symptom we have to be observed. Because before manifestation of such symptoms, destructive symptoms in the body, it manifests in the mind. In experience, extreme anxious and hysteric persons are more prone to cytokine storm. That nature in this, his temperament work as the sudden and progression to severe complication and death. In miasmatic view, the person shall be sorosyphilitic or syphilosoric. I consider the two rubrics from the mind, that delirium anxious. In anxious patients, the most sorosyphilitic or syphilosoric nature of the symptoms we search from the repertory or find from the repertory, that is delirium anxious. Delirium anxious is a uncontrolled trigger or fast symptom. And then the next is the excitement hysterical. It's also a destructive fast symptom. When we both symptoms we consider, we get the remedy camphor and ignitia. In this, from these two remedies, camphor is it cover the catarrhal condition, and it's a remedy more suitable for starting or the primary stage of inflammation. So I use it to treat further COVID cases. When I start the first day of the treatment, I give 4 doses of camphor 1 6 hourly. Then next prescription, I consider the further symptoms that we try to find out the PQRS symptoms, and the remedy will change to another. This will help. This helps to control the further complication and the progress of disease to further complication in my COVID cases. It find very successful. Next, the other group people are in the opposite end. Extreme carelessness persons, they neglect all his sufferings, does not move for a treatment. Most of the time, the family members will compel them to share his problem to the physician for a treatment. In this condition, the most syphilitic rubric comes for that nature of people. The danger, no sense of danger he has. Then delirium well declares he is. These two symptoms will comes to that particular type of person, that they're totally careless and avoiding treatment. The remedy comes was opium. So that type of person, the first day I prescribed opium 1 4 doses 6 hourly, then shifted the remedy to the other prescription, that is when by observation of the PQRS symptoms. That remedies will be different according to the case. In all cases, most of the cases I feel I think it is 99% of cases I treated COVID. I can prevent further complication by application of this logic in the treatment of COVID cases. This is the back end remedy that I selected miasmatically. 2 remedies that I given. First is camphor for anxious, excitable type of person, and the other careless and treatment avoiding person. I selected opium for the treatment. Then the other remedies, that is from the considering the PQRS symptoms. Relevance of PQRS symptoms in the fever management is the next step. PQRS symptoms equated to syphilis because it manifests, the PQRS symptoms are syphilitic symptom manifest in the particular level. That PQRS symptoms, most of the PQRS symptoms comes under the quality of syphilitic character, that is exaggeration, distortion, perversion, hysteria, destruction, autoimmunity, and genetic mutation. The criteria of miasmatic evaluation from the Mendel's, we categorize as group syphilitic, psychosis, and soric symptoms. From the physical, generals classifies syphilitic, psychosis, and soric symptoms. From the particular, categorize syphilitic, psychosis, and soric. Then forms a syphilitic group, psychosis group, and soric group. The first consideration for in the syphilitic group is the best way of selecting medicine to avoid complications or trigger to complication. This mostly it is applicable in chronic disease, but we can also apply in acute disease, especially COVID-like diseases, to avoid complication and missing the case. I am prepare some slides that giving PQRS symptoms. Just I'm trying to share. When we keep it in by taking screenshot, it will use many fever cases. Hectic fever with a drenching sweat, no thirst in fever is acetic acid. Drenching sweat relieving all symptoms. Remedies aconitum. Heat in palms and salt, low fever. In unhealthy climate is ammonium muriaticum. Much flushing, heat followed by cold, clammy skin, profuse sweat, abnormal sweat after influenza, amyl nitrosamine. Because the PQRS, abnormal sweat after influenza. Afternoon chill with thirst. Sweat breaks out and dries up frequently. Sleep. Sorry. Sleepy after the fever paroxysm. Chilly day and night as if bones are made up of ice. The bones are made up of ice. The PQRS in rainy weather is Arrhenia diadema. Symptoms related to typhoid, heat of the head, feet and hands cold is arnica. The hands cold, heat of the head, this is a PQRS. Septic fever, high temperature, delirium was after midnight is arsenic alb. Delirium is an out of control symptom. Is was after midnight is arsenic alb. Recurrent fever with drenching night sweat is arsenic iode. Drenching night sweat, it's an unusual night sweat is arsenic iode. Fever paroxysm, sweat smelling like garlic. It's a peculiar symptom. Sweat smelling like garlic. Artemisia. Fever chill, single parts icy cold, not relieved by covering heat of the room. That's Asarum europum. Chill, pain, soreness all of the body in typhus, baptisia. Sudden high fever, pungent steaming heat, icy cold is belladonna. We know the belladonna fever is very sudden onset and high nature of temperature. That's steaming like a heat. Then feet icy cold. Feet icy cold is the PQRS. Then icy coldness of body, cannot tolerate covering. The tongue cold, flabby, and trembling. First stage is camphor. Camphor shows when we ask the patient to show the tongue. When protruding the tongue, the tongue shows trembling. In fever cases, that much debility or that much weakness and trembling is shows in the early stage of the fever itself. The remedy will be camphor. Cold hands and feet, false bones, objective coldness and subjective burning is cantharis. Shivering after drinking, thirst before chill is capsicum. Chill begins in forearm, perspiration, eating, exhausting sweat, carbovegetabilis. Perspiration on eating. The aggravation on eating is in many conditions, carbovegetabilis is comes the main remedy. Cough during eating, perspiration during eating, etc. In fever condition, perspiration during eating is again comes carbovegetabilis. Continuous fever in acute or chronic, weakness with extreme weakness in continuous fever, chininum ars. Fever with a clean tongue, much hunger, colicky pain, face cold, and hands warm. The remedy is China.
It's Sina, Dr. Sina.
Sina. Fever with a clean tongue, much hunger, colicky pain, face cold, and hands warm is Sina. And fever intermittent, return every week. All stages are marked. Debilitating night sweat, little exertion, fever paroxysm, never at night. China. Here the PQRS symptom is a clean tongue. PQRS symptom is sweat from little exertion. Even a movement, there is profuse sweat is the PQRS. The same symptom is written in sepia as the sweat from least motion. Almost this both sepia and in China, little exertion or little movement produce profuse sweat. Nervous fever, most of the respiratory written a cocculus indicus. Hemorrhagic or purulent character of fever, bloody sweat, cerebrospinal meningitis, cold sweat is crotalus horridis. It's expressed by when the fever paroxysm or when the fever comes, the patient complains, the white cloths turns to yellow or in brownish color by the sweat. That is the hemorrhagic or purulent character of the fever, and then bloody sweat is manifest like that. The dress shows yellowish or brownish color. The medicine is Crotalus horridis. Dry heat and burning of the skin, chillness with is dull camera. Dry heat and burning, chilliness with burning, chilliness with is the PQRS. Burning, chilliness with is the PQRS. At the same time, the patient manifests perspiration and cold dampness of the skin. So dull camera. Fever with sprouting, diarrhea, lactirium, ecbalium. High temperature accelerated, but no strong pulse. Eucalyptus. Eucalyptus is a good remedy for high temperature. Perspiration relieves all symptoms except head. It's a Eupatorium perfoliatum. Perspiration relieves all symptoms except head. The head pain or the headache, etc., will not relieve, but all other symptoms will be relieved by perspiration. Body ache and other symptoms will temporarily relieved by perspiration. But the headache remains. That is PQRS of Eupatorium perfoliatum. General coldness of the extremities, heat in the palm and sole. Sweat debilitating is parametallicum. Sweat debilitating. Debilitating weakness after perspiration. Heat and the palm feels heat in the palm and the soles. All catarrhal inflammatory fever of first stage is paraphosphoricum. We know paraphosphoricum is the remedy for first stage of inflammation. During fever, forget where he was. Some patients express he totally forgets where he was, and a blackout like symptom, that is formalin. Slow, soft foot pulse, chill up and down the back, great prostration, violent headache, no thirst is gelsemium. We know it is the characteristic of gelsemium also. It is a PQRS. Fever with itching, nettle rashes all over the body. Medicine is Ignatia. Heat flushes all over the body with the fever, iodine. Fever relapse from improper diet. The relapsing of the fever from improper diet. The fever is treated and improved for 1 or 2 days. Then a little change in the food, a little oily food or any non-vegetarian food, or any change in the food to cause the relapse of the fever. The remedy is Ipecac. Rise of temperature at night, yellow slimy tongue is Calisulf. Calisulf is a very good remedy for the night fever also, especially the tongue is yellow. Fever, hot flushes and hot perspiration is lachesis. The iodine, hot flushes all over the body, but there is no perspiration. But in lachesis, hot flushes and hot perspiration is lachesis. Fever with the chill between 3 and 4 p.m. followed by sweat is lycopodium. 3 and 4 p.m. is a peculiar aggravation of lycopodium. It's also the peculiar that at a particular time there is chill and fever, the point for the lycopodium. Chill in evening, fever at night is macarb. Wants to be fanned all the time. Flush of heat in face and neck is medorinum. Flashes of the heat in face and neck. Lachesis all over the body with the hot perspiration. Hot flushes without perspiration is iodine. Here the hot flushes in the face and neck, medorinum. Gastric or bilious with the profuse night perspiration, heat and shuddering alternately. Profuse perspiration without relief is Mersol. Heat and shuddering alternately. Heat and shuddering alternately. That is the PQRS level symptom in Mersol. Chill between 9 and 11 a.m. Heat with violent thirst, increase with fever, fever with blisters, that is natriuria. Fever, blisters, the natriuria muriaticum is a good remedy during fever. Herpes simplex like eruptions manifest in around the lips or mucocutaneous areas. No other remedy, I think, giving result like an natriuria. Cold stage predominates. Paroxysm anticipate in morning gastric symptoms. That's Naxomica. Chill predominating is Naxomica is the very good remedy. The chill starts, but the fever and other symptoms follows. we can select nexomica. It's a very peculiar symptom of nexomica. Chill predominate, cold stage predominate. Excellent remedy in influenza, fever associated with the cough, acute pain in body, bone pain, soreness of the muscle, violent headaches, Ocimum sanctum. So Ocimum sanctum is very close to Eupatorium perfoliatum. But in Eupatorium perfoliatum, the catarrhal symptoms, the intensity of the catarrhal symptoms is very low level. But in Eupatorium, Ocimum sanctum, the catarrhal symptoms will more marked. Fever characterized by stupor, snoring, respiration, twitching of the limbs is opium. Stupor and snoring, respiration. That is a PQRS and characteristic of opium. Low type of fever with dullness and stupor, acid phosphoricum. The low type of fever, the temperature is most of the time this temperature is a low type, not comes to a higher level with the dullness and the stupor. That's acid phosphoricum. A dynamic fever, less thirst but unnatural hunger is phosphorus. In phosphorus, even though the patient manifests severe fever, weakness, all other symptoms of the inflammatory condition or the viral fever condition, the patient, the hunger will not comes down. The thirst and hunger will not comes down. It will be little higher. That is a peculiar indication of phosphorus in fever cases. Sometimes the thirst comes down, but the hunger will not comes down in phosphorus patients. Great loquacity during fever is podophylla. Chilly with pain in spots towards evening. Chill in 4 p.m. Wandering heat, distended vein is pulsatilla. Wandering heat, it's a peculiarity of pulsatilla and characteristic of pulsatilla. Same time, pain in spot, it's also changing, wandering type. Septic fever, chill begins in back, temperature rise rapidly, great heat with profuse hot sweat, but sweat does not cause fall in temperature, is pyrogen. In septic fever, high temperature, there is high temperature, the patient manifests profuse sweat, but the sweat does not cause fall in temperature. The temperature, the temperature will remain, the same time the person manifests perspiration, drenching, profuse perspiration. But the temperature will not comes down temporarily even, that is pyrogen. Fever called sensation internally with the chattering of the teeth, radium. I tried some cases. Typically, the person manifests chattering of the teeth in front of us. I prescribed a radium bromide. It's giving good results. Lacrimation during fever. In repertory, the other medicines like sepia, natramur, etc., are giving is given as a front level medicine, but Sabadilla also a good remedy in that PQRS, lacrimation during fever paroxysm. Frequent flushes of heat, sweat from least motion is sepia. Earlier I said that from least exertion and little exertion is China. Flushes of heat, sweat on the palm, alternately hot and cold, spirandus. I have not tried the remedy, but it's a PQRS remedy. PQRS symptom is mentioned in that remedy. Violent fever, profuse sweat, which does not give relief. Violent fever, profuse sweat, which does not give relief. Another remedy is stramonium, like Merxol, then pyrogen, Apis mellifica, and stramonium. There is a little differentiation in those also. In pyrogen, I already mentioned the fever and high fever, there is perspiration, but there is no change in the temperature, same continues. But in violent fever, profuse sweat, which does not give relief, that is, the temperature may comes little down, the other sufferings will continue. That is the in stramonium. Sweat on uncovered parts all over except head. When sleeping, profuse honey smelling sweat, that is tuja. Profuse honey smelling sweat is tuja. Artemisia vulgaris already mentioned, the garlic smelling sweat, pungent garlic smelling sweat is Artemisia vulgaris. Here, honey smelling sweat is tuja. Hyperthermia in evening and hypothermia in the morning. It's a peculiar symptom of Veratrum viride. Suppurative fevers with great variation of temperature. the hypothermia to hyperthermia. That hyperthermia in the evening and hypothermia in the morning. That the both extreme variation is shown by the veratrum varied. Fever ameliorated by drinking beer. That is veratrum alb. It's very peculiar, but very rare to manifest, to observe also. Blood feels hot during fever. That is nitric acid. Face ache during fever, spongia. Heat on the stomach, aconitum. These symptoms mostly helpful. The temperature begins in the only on the abdomen or stomach area. The other part of the body is called. Just to begin only, so no other symptoms. So we can prescribe aconitum. Heat on the stomach, head and face. Some patients will manifest or share this symptom: heat on the stomach, head and face. No other area there is no temperature. That is Apis mellifica and same aconitum. All body cold: mesarium, cuprum ars, cocculus indicus. Heat in the face and coldness of the body: cannabis indica. Febrile heat with colic, veratrum alb. Febrile heat with colic. I treated a case, relapsing type of fever case. This symptom, febrile heat with colic. Sweat on one side, there's a pulsatilla. Sweat right side, metacarb. Sweat head and neck, belladonna. Sweat hands only, agnus. Sweat palms only, bromium. Sweat palms only at night, sorinum. Sweat fingertips, profuse dripping, that's podophyllum. Sweat covered parts only, belladonna. Nephritis, influenza after eucalyptus. Influenza cause debility, arsenic alb, cypripedium. General complaints after influenza, scrofularia. Fluent coryza with influenza, sabadilla. Intense pain in cervical vertebra with influenza, allium, cepa. Delirium, influenza in antimtar and chiltonium. Delirium, influenza in antimtar and chiltonium. Heavy head with influenza, gelsemium, coryza. Bloody in influenza, arsenic alb. Coryza burning in influenza, arsenic alb. Violent coryza in influenza is arsenic alb. No stopped in influenza, ticta. Toothache in influenza, axol. Sore throat with influenza, sanguinaria can. Sanguinary can is also a medicine for nasopharyngitis also. Nose with nausea with influenza, antim-tart. Retching with influenza, antim-tart. Vomiting with influenza, ipecac, eupatorium, baptisia, tarcolactic acid. Diarrhea with influenza, dulcamera and arsenic alb. Bronchitis with influenza, lycopodium. Bronchitis after influenza, rumex. Croup after influenza, heparsulf. Voice hoarse, influenza in philandrinum. Sleepless with headache in influenza, pulsatilla. Chilliness, back up and down, gelsemium. Bone pain, influenza in Rastox, eupatorium perfoliate. Weakness, influenza after conium caliphosphoricum. Biochemistry for influenza, paraphos, caliphos, and natron. Swollen upper eyelids in influenza, sanguinaria can. Deafness, influenza in gelsemium. Nose bleeding, influenza in ipecac and phosphorus. Influenza cause abortion, camphor. Sleepiness, influenza in gelsemium and baptisia. Sleepiness after influenza, avena sativa. Sleeplessness after influenza, avena sativa. Hearing lost, influenza after salicylic acid. Viral fever after, we can try salicylic acid. Body pain after influenza, solanum lycopodium. Solanum lycopus. Sciatica, influenza after iris versicolor. Chill, influenza after China. Convalescence after influenza, gelsemium. Liver complaints after influenza, Cardus marianus. These are the some rubric and single remedies from the repertories, mostly from the repertory I collected from.
Doctor, I think you can have another session of this. Is very, very extensive and vast topic, doctor.
Almost the slides are finished in a few slides only. Few slides of just.
Repetitions needed, doctor. Otherwise, you can't remember all these such extensive topics.
Yeah. So I can stop by this. In further slide, I am just mentioning some rubrics.
Don't worry, doctor. I think we can have another session.
Okay.
So that our participants will be more benefited, definitely.
Yeah, yeah.
Very, very vast on result as a result of extensive study.
I collected those symptoms and most of the time when the PQRS symptom is observed from the patient, sometimes the remedy I'm not remember, I am just refer from the computer and prescribe. The symptoms are collected and store in my as a folder, and I check and that type of symptoms when I observe, and not total. I am not in by heart almost, but using the remedies, it will comes in our minds for the further prescription.
Doctor, we can have. Hello, doctor.
Yeah,
we
yeah.
can have another session next week itself if you are if you have a convenient date.
Yeah.
If you have a convenient date, you can announce the date today itself.
Okay, we can continue.
Except on November 5th. Except on November 5th.
Yeah.
There was a meeting on November 5th.
Yeah.
Okay.
Yeah.
So that all those who are following this webinar can attend on that session. They are also have a prior knowledge about the date also.
Yeah.
So in between, you may decide the date and you may announce it in this webinar itself. That's a good thing.
Okay, doctor.
Okay.
Yes. I think now you can go to the discussion round. Isn't it, doctor? Yes. Well, what we are hearing and listening is wonderful session from Dr. Unni Veliath in expose of the possibilities and requirements of homeopathic physician. In fact, a homeopathic physician must live for more than 150 years. Then he can learn at least a very small fraction of the homeopathic science. Yes. Now it's time for discussions.
Yes, sir. Yes, sir. Yes, Dr. Manoj, as you rightly told, it is a very good subject and it was well presented and with full of screen sharing, and that is what is Dr. Unni Veliath is all about. Whenever he was asked to present such a paper, he definitely come with this slides in a beautiful way. We need to congratulate him for that also.
Those who are interested to participate, please go to the participant list and raise your hands. Very important discussion. We need the importance of each and every symptoms the patient describes. So we must be more aware of that. The importance, the genius of homeopathy is this, where it is always each and every patient will be presented with a lot of individual symptoms. But unfortunately, what happened is that the physician often misses that. They are still ignorant. See the vastness of homeopathy. That's most important.
We can observe that type of symptoms only. We are aware with that symptoms only. Yes. Otherwise, we cannot observe that PQR symptoms. Just the patient tell, and the physician will not observe for a better prescription.
As somebody says, eyes do not see what mind does not know.
Yeah.
So the proper feeding of mind is very important. It requires extensive thinking as well as reading. Both together can make a good homeopathic physician. When we compare the study of homeopathy with other sciences, this is the most difficult one, I think. Even for a single case of fever, thousands and thousands of rubrics and symptoms. So, yes, those who would like to participate can go to the participant list and raise your hands. What is happening in that is the trend that everyone is waiting for last, then starting to ask after we have, at the time when we have to conclude. That is why unfortunately it happens. We have to conclude by 9 o'clock. Dr. Salim, Vice Chancellor. Dr. Salim, please. Okay.
Yeah. Salim.
Dr. Salim Kumar, you have lifted me to a certain heights, and I become more confident than yesterday in treating fever. Okay. It's an extraordinary brilliance. I know about you. Even then, in this platform, your fame become more and around the globe. And because in treating fever, nobody is giving such importance to these peculiar symptoms. We are generalizing the fever. Even if we are homeopaths, we are generalizing the fever and giving anaxomica, etc. Somewhat. Now you are the true homeopathic way you are prescribing it. Okay. Thank you, and congratulations on attaining this. Okay.
Yes, Dr.
Thank you,
Salim.
Salim.
Yes, it's a nice observation, Doctor. Thank you, Dr. Salim. And now Dr. Matthew, please unmute yourself and participate. Okay. Dr. Matthew.
I have a small question. I have a case having post-COVID urticaria.
Yeah.
Urticaria. And I gave them Pulsatla and Restox and didn't work. Do you have any suggestions, doctor?
Urticaria, COVID after.
Yes.
Yes.
I think there is no.
We can in flu remedies or fever, after fever or during fever, after fever.
During fever,
Urticaria
urticaria during fever, the remedy comes Copaiva, Ignatia, etc.
Yes.
Belladonna is also one of the best remedies, sir.
Remedy, but the case is a subacute articarial case. I think it's best to select a constitutional remedy for that case. There is, I think,
it was 1 month ago, 2 months. It is 3 or 4 months ago she had COVID,
okay.
and this is. They told them it is.
In my knowledge, one or two doses of Zorinum 0/3 will help that case, because Zorinum is a very good remedy. Convalescence influenza after that rubrics comes also comes in COVID also, because COVID is all a viral fever. Now homeopaths are mostly using the rubrics related to fever or influenza. The post-COVID symptoms, weakness and other symptoms, we mostly search in convalescence influenza after, or influenza after, or fever after. That is the rubric. In that that way, when we considering this case, a very possible remedy shall be Zorinum. So it's better to give Zorinum 0/3 weekly doses. And I think another specific remedy for urticaria is natrum phosphoricum from the biochemical. So Zorinum 0/3 once in a week, and give natrum phosphoricum 6 once or twice daily may save that patient. From short conversation, we can select that medicine. Otherwise, in constitutional way, any other remedies will come.
Yeah, the post-COVID urticaria is post-COVID urticaria is a very common symptom in US and all. Yeah. Okay, thank you.
Okay.
Yes, I think, Doctor, the role of opium, we cannot forget. In almost all cases, Hahnemann in the upwards of 183 footnote, he says there is a slowing down all process of the human organism to activate, to restart, just like the refreshing the computer. We can give opium, but unfortunately, we are not at all giving due respect or due importance to opium. Just this is Hahnemann. In almost all cases, we know that you often select a remedy, not a medicine, a remedy. But what happens? It will not act. At the time, opium is a wonderful medicine as suggested by Hahnemann.
Okay, it is a remedy, and all the reaction of the patients is
Yes.
comes down.
Yes.
Opium will help. Also, sepia at the same level.
Yeah.
It's a stasis of the system after use of multiple drugs. The opium comes. Sorry, the sepia comes.
Yes, good suggestion. Yes, really valuable one, doctor. Unfortunately, our listeners are
Yes,
not.
sir. There is one.
Yes.
I would like to add one more point here that the fever, articaria during fever, one of the best remedies, as far as from my experience, is belladonna, and belladonna work wonderfully in those cases. In the above said case, I think this post-COVID syndrome actually it is due to suppression of symptoms by these allopathic medicines, and actually that is the result of that's the reason for this post-COVID syndrome. Actually, no post-COVID syndrome is reported by anyone after taking homeopathic medicine.
Yes, exactly.
So,
That's right.
so
Okay.
sulfur may be one of the best remedy, as you rightly told that solinum is one of the best remedy for that also.
Okay. Yes. Now, Dr. Prajisha raise her hand. Dr. Prajisha, please unmute yourself.
Hello.
Yeah.
Hello. Yeah.
Hello.
Sir, post-COVID, this diabetes cases is there? No. So, and even D-dimer increased case. So, what is your suggestion for that?
In D-dimer increased case, I get more result with the Crotalus H 200 will give good result. And all same time after Crotalus Hordes, we can give Bothrops also. In lung predominated symptoms, there is ammonium carb also a very good remedy to prevent pulmonary embolism. We can give ammonium carb also. So start with Crotalus Hordes, then with Bothrops, and end with ammonium carb. That is the way.
And during that COVID case, can we give this Bothrops like to prevent?
Same. It is a very good strategy in giving that type of prescription. I used that also, tried that also. When the symptoms controlled by the formerly I said either by camphor, opium, or the remedy selected close then observing PQR symptoms, then I start Crotalus Hordes 3-4 doses once daily in 4 days, then give Bothrops for 4 days. It gives after that when we checking the D-dimer, ferritin, and the LDH, etc. All the result become normal, and the patient not going to any other complications. We said early the opium and the camphor prescription to avoid cytokine storm. Accidentally, there is chances of occurring cytokine storm. That miasmatic prescription will help to prevent cytokine storm from the first 2-3 days. Then we prescribe medicine to avoid the microthrombus formation, then clot formation and embolism. That these 3 remedies, that is Bothrops, first Crotalus Hordes, then Bothrops, then ammonium carb, and also in radar another remedy, ACTH, the adrenocorticotrophic hormone, also a good remedy in general thromboembolism, venous thromboembolism. So will prevent also venous thromboembolism. The adrenocorticotrophin, ACTH, that medicine is available. I also tried ACTH.
Sir, I missed your first section. So if we'll start with COVID, this opium or what? Like
in anxiety patient, 2 type. I am just classify the patients into 2. The first is a very anxious type of patient, and the other patients is very lazy, careless type of patient. I give 4 doses of opium for the anxious type of patient. That patient from the beginning onwards that they express fear and anxious, and they rush to the treatment. They call the doctor and immediately they will collect the medicine and they take the medicine very, very correctly, very strictly. That type of patients in anxious hysteric type of patient, there may be chance to trigger of cytokine storm and complications. So we give the first prescription camphor 1 mg. Some other patient there never comes to treatment. The family members compel them to take medicine and consult or share their problems to doctor. That type of patient, very neglected type of, very careless type of, lazy type of person. That person need opium. That rubrics I given is danger, no sense of danger. The prime remedy comes opium. Also, the very in syphilitics level, opium is a very contented, very satisfied type of person. So he has no fear, but that fear, fearlessness will goes to a danger. That is the no sense, danger, no sense of danger. So that type of patient we give 4 doses of opium.
Okay. Okay.
First
Dr.
4 days
Veliath.
or what, sir?
Opium 1 mg in first when we starting the case 4 doses 6 hourly, then shift to the remedy observing PQRS symptom. That is the front end syphilitic symptom. PQRS is the front end syphilitic. The other camphor and opium is the back end. That is related to mind. So start with that. Then the front end is PQRS by observing PQRS. That any remedy comes from the list. I share the PQRS symptoms sharing from the list. Any remedy comes.
Yes.
We even artemisia vulgaris, if a person manifests with very pungent garlic smelling sweat, we prescribe artemisia vulgaris like that. Sweet smelling sweat,
Yes.
etc.
Okay, doctor. Yes, that well the individualization is the genius of homeopathy, as Doctor said. To kind wind up the session, I am now inviting Dr. Jayachandran to say the out of thanks. One of the senior most participant, Dr. Jayachandran. Okay, there is no connection with Dr. Jayachandran. Dr. Hubert is still there.
No.
Ah, yes, okay, yes, please. There's a lot of thanks, doctor. Okay.
Hello.
Yes, audible. Yes, please.
Hello, doctor. A very nice section, a very nice class. It is very valuable to our and the junior doctors, practicing doctors and junior house surgeons, etc. We are humbly requesting you to continue the class again. On behalf of IH and all of us are giving our humble thanks and to you.
Okay, yes.
Okay, good night.
Well, that was the end of today's session. 424 day of continuous Zoom session IFPH English edition is over. We shall be back again tomorrow with another topic at 8 o'clock. Till then, goodbye. It's now over to Dr. Yahya for continuing Malayalam. Okay, Doctor. Here.